Do you know the difference between psychiatrist and psychologist? The difference between psychologists and psychiatrists is often ignored and misunderstood due to lack of awareness. The terms psychologist and psychiatrist are often used interchangeably to describe anyone who provides therapy services, but the two professions and the services they provide differ ranges from education, their approach, course of treatment and practice. Treatment. Psychiatrist, psychologist, psychiatrist are medical doctor. They can prescribe medication for mental illness. Their treatment plans involve medication and its management. Assess both the mental and physical aspects of psychological problems. Psychologists are not medical doctors, cannot prescribe medication. But a few states allow to prescribe a limited number of psychiatric medications, if they've taken a course or holding a postdoctoral master's degree in clinical psychopharmacology. Psychiatrists use a variety of treatments, including various forms of psychotherapy, medications such as antidepressants, antipsychotic medications, sedatives and anxiolytic, hypnotics, mood stabilizers, stimulants, etc. Psychologists use therapeutic treatment which involves psychotherapies, counseling, behavior management, clinical assessments and psychological testing, while depending on the severity of the client's symptoms, psychologist may refer the client to a psychiatrist for the prescription of medication. Treatment. Psychiatrist, psychologist. Psychiatrists utilize the mental status exam, MSE, a clinical assessment to diagnose a patient's behavioral and cognitive functioning. They also provide psychosocial interventions and other treatments, such as electroconvulsive therapy or ECT involves applying electrical currents to the brain depending on the needs of each patient, most often used to treat severe depression that has not responded to other treatments. Psychologists utilize the Diagnostic and Statistical Manual of Mental Disorders, DSM, to diagnose people who are experiencing symptoms of psychological illness. Administer and evaluate psychological tests such as personality tests, clinical interviews, behavioral assessments, and IQ tests, etc. Cognitive behavioral treatment involves efforts to change thinking pattern and behavior. In some cases, CBT is supposed to be more effective than pharmacological treatments. Education. Psychiatrist, psychologist. A psychiatrist is a trained medical doctor with specialization in psychiatry. They complete MBBS and further do specialization in psychiatry. They have specific training in the assessment, diagnosis, treatment and prevention of mental illness. Psychologist completes their bachelor's and further, they may also hold master's or doctorate level qualification in psychology. If they have a doctorate, PhD, a psychologist can call themselves doctor but they are not medical doctors. Clinical psychologists have also special training in the diagnosis, assessment and psychological treatment of mental illness. Psychiatrists' study focuses on biology and neurochemistry. Psychologist study focuses on human thought, behavior, development, personality, emotion, etc. Psychiatrists are qualified to assess both the mental and physical aspects of psychological problems. Psychologist can specialize in a number of areas, such as mental health, education and occupational psychology. In healthcare, psychologist specializes in clinical, counseling, forensic or health psychology. Both play important roles in mental health treatment. The psychologist and psychiatrist may work together. Very often, they work in collaboration with one another to provide the best possible treatment for an individual, with the psychologist offering behavioral interventions and the psychiatrist providing or adjusting medication. The type of approach needed often depends on the severity of the symptoms. According to research, patients differ as to what is preferred, psychotherapy alone or in combination with medication, which, therefore, can affect what professionals they see. While psychologists and psychiatrists may have some overlapping responsibilities, such as conducting psychotherapy and performing research, some research suggests that combining CBT and medications may be more effective than medication alone in the treatment of some conditions. Subscribe and press the bell icon for more updates.